If at any point during this video you would like to switch topics, click on the section title from the table of contents on the left. If the table of contents is not visible, click on the appropriate icon in the lower right-hand corner to display it.
Welcome to new enhancements and features in 4.7. First, we'll cover some of the updates to current functionality, such as the changes to the reconciliation report, the smoking history dialog, the race and language system tables, and the patient representative dialog. Then we'll move on to new functionality. Within this, we'll break it down into enhancements related to template editing, since there are a few of them in this release, versus the rest of the changes, such as SNOMED additions and medication history consent. We are going to start off today with the changes to the reconciliation report. The reconciliation report can now be run for the clinical quality measures. Let's go into the dashboard and take a look. You'll go to Reports and then Meaningful Use Dashboard. First, you will select the measures from the left and then click Calculate. Remember, in order to generate the reconciliation report, you must first highlight the measure in question, and then you would set your options for the report at the bottom. You can choose to see the patients that were not included in the numerator, the patients that were included in the numerator, or both. Once you have selected your criteria, click Generate Reconciliation Report. The appropriate information will then be displayed. The reconciliation report is a great troubleshooting tool if you have questions about your statistics. So to recap, with this latest addition, you can now run the reconciliation report for any measure, whether it is a core, menu, or CQM. Next, we'll talk about the additions to the smoking history dialog. We'll open up a progress note to take a look. Then click on Smoking History. You will notice, once you select that the patient is or was a smoker, that there are some new fields. We have added fields for start year and end year, allowing you to document that information if you prefer to do so. These fields are not required, they are for informational purposes only, and are not related to meaningful use. The end year field will only become accessible if the former smoker option is selected from the smoking status section. Please keep in mind that the software is not going to do any validation based on the information you put in year smoked and start year. So for example, it will allow you to put 2 in year smoked and 2000 in start year, even though that might not make sense. So just be careful when entering that information. And of course, when you click OK, you will see the appropriate information that you documented output in your note. So to recap, there are 2 new fields in the smoking history dialog to allow you to document start and end year. Neither of these fields are required, and they are not related to meaningful use. Next, we'll discuss the days supply field in the prescribe dialog. We first discussed the days supply field in our 4.6 training. At that session, I told you how the days supply field was added in preparation for a clinical quality measure for meaningful use that will need this information. However, if you remember, it is not a required field. The change that was introduced to this field in 4.7 is that now it will automatically calculate whenever the dose, frequency, and dispense fields have been entered. You will no longer need to manually figure out the value for this field. So let's enter some information in here and see what happens. Let's say they should take 1 tablet twice a day, and we are dispensing 180 tablets. You will notice that the day's supply automatically was set to 90. Please keep in mind that the calculation does not occur if a previously saved medication already had a day's supply value. However, calculation will resume once one of the aforementioned fields are modified. So to recap, the day's supply field will now automatically be populated when you enter dose, frequency, and dispense. Now let's talk about the modifications to the language and race system tables. Both of these tables were updated to allow you to modify language and race options and still be in compliance with the standard format required for meaningful use purposes. Beyond giving you the ability to add new options, you will now also have the ability to document that the patient declined to specify their language or race preference. First, I'll show you the language table. To access this table in Clinical, go to Edit, System Tables, Codes, Language. You can also access this table through Practice Manager by going to Administration, Code Tables, Codes, and then Language. Whether you are doing it in Practice Manager or Clinical, the information I'm about to show you will be the same. Immediately in this dialog, you will see the languages you have already been using. If you see a Y in the System column, that indicates the language was a standard choice that came preloaded with the software. You cannot modify or delete system-defined languages. If you would like to add a new option, click New. The first field that you will enter is the code value. Think of this as our in-house code. You can make this whatever you want, as long as it is a 3-digit alphanumeric code. Then you will add a description. And lastly, you will need to select the correct ISO 639-2 code from the standard mapping field. The standard mapping field is the most important field since this is what the queries for meaningful use will be looking for. When you are done, you can click Add to List, and then New if you have another one to add, or Save All if you are done adding options to the table. If you have added new options, you will see those options in the language dropdown in the patient account, either in Practice Manager or Clinical. In Clinical, this information is located on the ID tab. If you expand the language dropdown, you will see the new option you had just added. Now let's go back into the System Tables menu and talk about the modifications to the race table. So you'll go to Edit, System Tables, Codes, and Race. You will notice that this table is set up with basically the same fields as language, so the steps to add or modify a race option are the same as I showed you with language. You cannot modify or delete system-defined races. You have the patient decline to specify option, and to add a new option you would click New. Again, the code value is a 3-digit alphanumeric field that can be set to whatever you want. The description field would be the name of the race, and then lastly you will select the correct OMB standard code from the standard mapping field. There are only 5 options for the OMB standard code, and these were defined by the Office of Management and Budget, or OMB. You can, of course, have multiple race options that are linked to the same OMB standard code. Please remember that if you had added language or race options to your database prior to version 4.7, you did not have access to the standard mapping field, and therefore you will need to go back in and edit the options you had added. Okay, so to recap, you can now add your own languages and races into the database from within Clinical or Practice Manager and have them be in compliance with the OMB standard. This in turn will give you more flexibility when specifying language or race for a patient. Next up is the enhancement to the patient representative dialog. To access the patient representative dialog, open the patient's account. Then click on the ID tab and scroll to the bottom. You will see a patient representative section. This section allows you to add various representatives for the patient in case they are a minor or have a power of attorney, etc. To add a new representative, you would click Add. To edit an existing one, highlight their name and click Edit. From within the Patient Representative dialog, you will see the options to add the representative's information, such as phone, address, relation, etc. The new addition to this dialog is the Patient Portal section at the bottom. You now have the ability to authorize a representative to access this patient's information on the patient portal. Please keep in mind that in order for these fields to be available to you, this patient must be registered for the portal already. If the patient portal button at the bottom of the screen is not green, then they are not registered. If the patient you are viewing is not registered, then the patient portal section within this dialog will be grayed out. If you add that representative's email address, click Enable Representative for Patient Portal, and then click OK, you will be authorizing this person to have access to this patient's information located on the patient portal. Upon authorization, the representative will receive an email confirmation. They will need to complete the registration, just like the patient did, in order to access the patient portal. Once they complete the registration process, they will be able to view clinical summaries for each office visit, be able to view, download, and transmit health information, as well as send health-related messages to the provider. Or in other words, the patient representative will have full access to the patient's patient portal account, just as the patient does. Any patient representative activity regarding the patient's health information will be tracked and counted towards the applicable meaningful use objectives. So to recap, you now have the ability to authorize a patient representative to access the patient portal on behalf of your patient. Now let's move on to discussing the changes to template editing features. All three of the enhancements we'll discuss are related to meaningful use in some way. The first two, the addition of the Chief Complaint button and the changes to the checklist properties, are related to the information that will print on your clinical summary. The last enhancement, the prompting of positive or negative findings in a numeric field, is related to lab values being documented for CQM purposes. The first thing that we will discuss is the addition of the Chief Complaint button. So let's go into Template Editor and take a look. You will now see a new template tool for Chief Complaint. If you place this field in your template and begin using it to document your Chief Complaint, the Chief Complaint will then print on your clinical summary. If you decide not to use this new functionality, you will still receive credit for your clinical summaries, even though the information will be omitted. It is recommended, however, to include this information since it will give the patient a more extensive view of the coordination of care. In order to begin using this field, simply place your cursor in the template where you would like the new button to go, and then double-click on Chief Complaint from the left. This will insert the new field into your template where your cursor was. There are no additional configuration options available for this field. If you are adding the new field, you will want to remember to remove the old Chief Complaint field by clicking and dragging it to the left if applicable. But remember, the chief complaint link that we provide in our standard template also includes HPI information, so you may need to make additional template changes so that you do not lose that functionality. For this example, I'm just going to remove it from my template. Now let's see how this new field works in a chart note. Remember that whenever you make a change to a template, you will not see the changes on previously opened notes. You must open a new note to see the change. Here we will see our new field. In order to document the chief complaint using this field, simply click on the button. This will launch a free text box that you can either type or dictate into. Once you are done, you would click OK. If you use this new field to document your chief complaint, then you will see it print on your clinical summary. The clinical summary will look similar to this when printed. Now, all that being said, there is another way for you to document the chief complaint and have it print on the clinical summary if you do not like the free text box, and that is the enhancement to the checklist functionality. Now let's go back into Template Editor and take a look at the checklist properties. If you right-click on the blue bar of the checklist, you will receive the Properties dialog for that checklist. The new functionality within this dialog is the Include As dropdown at the bottom. If you click the dropdown, you will see there are 5 options to select from: Chief Complaint, Clinical Instructions, Cognitive Status, Functional Status, and Goals. By selecting an option in here, you are designating that this checklist will be used to document that information. And therefore, whatever information you click off from this checklist will be printed on the clinical summary under that section. Please keep in mind that in 4.7, only the chief complaint option from here will work. The remaining 4 options will be supported in 5.1. If you decide to use a checklist to document your chief complaint instead of the chief complaint button, your clinical summary will print out similar to this. Okay, so to recap, we now have 2 new options for you to use to document the patient's chief complaint and have it output on the clinical summary. You can either use the new Chief Complaint button, which will allow you to free text or dictate the information in, or you can use the checklist functionality and configure the Include As field appropriately. Remember, if you decide not to use either of these new options, the Chief Complaint will not print on your clinical summary. However, that will not affect whether you receive credit for the clinical summary meaningful use objective. Okay, so our last template editing enhancement is the addition of the prompt to document whether a finding is positive or negative within a numeric field. We'll go ahead and open up my lab results template to take a look. The new enhancement was made to the numeric field, so we'll first start by inserting a new numeric field into our template. Then, in order to modify the properties, we'll right-click on the field and select Edit Properties. From within this dialog, you will see the new field at the bottom. However, it will be grayed out until you select a condition. When you click Condition, it will allow you to search the database of any conditions designated as results. I'm going to choose TSH for our example today. Now you will see the field become available. If you have this functionality turned on, after entering a value in this field from within your chart note, a pop-up dialog will appear allowing you to manually select whether the result is a positive or negative finding. Positive refers to an out-of-range lab result, and negative refers to an in-range result. This functionality will need to be used if you are attesting to certain clinical quality measures and you are manually entering lab values into your database. If you have a lab interface in place, then most likely you are not manually entering lab values and wouldn't necessarily need to worry about this configuration. The positive and negative designation have their own unique SNOMED concept IDs that are saved to the database upon selection. That SNOMED concept ID is how our software knows to give you credit for documenting the positive or negative designation and also the applicable CQMs for meaningful use. I'm going to go ahead and finish up setting up this field, and then we'll look at it in a chart note. Now we'll open up a chart and open up the lab results note. After entering a value into your field and then either clicking Tab or just somewhere outside of the field, you will receive this pop-up dialog. From within here, you will be able to designate whether this is a positive or negative result. Positive refers to an out-of-range lab, and negative refers to in range. You would select the appropriate radio button and then click OK. Notice nothing additional will print in your note. If you look in the History tab, you will see the corresponding SNOMED concept ID documented for the lab result there. You will not necessarily do anything with this, but the software will use this information to count towards any applicable meaningful use measures. So to recap, if you are manually entering lab values and are attesting to certain clinical quality measures that require this information, you can now configure your numeric fields to prompt whether the lab value is positive or negative. You must turn the option on through Template Editor first before the software will prompt you. Now let's move on to our last two enhancements, which are completely new to the software. The first is the addition of SNOMED codes on the procedure dialog. In our 4.6 training, we introduced the concept of SNOMED, and I showed you how to attach them to a diagnosis. Now in 4.7, we have that same ability for procedures. We have also updated the way the controls work to make working with SNOMED codes a little more user-friendly. As a reminder, SNOMED CT stands for Systematized Nomenclature of Medicine Clinical Terms. SNOMED is a terminology used to describe the care and treatment of patients. This terminology uses numeric codes to represent medical concepts, including symptoms, diseases, procedures, devices, and medicines, thereby eliminating the confusion that may result from the use of informal or local terms or phrases. The use of SNOMED codes to record clinical data is one of the certification criteria for Meaningful Use Stage 2 and allows for a consistent recording of clinical data with the aim of improving patient care. If you are participating in Stage 1 of Meaningful Use, you are not required to start using this information yet. For those of you moving on to Stage 2 next year, let's take a look at how you will attach SNOMED codes to your procedures. When you select a procedure, you will now see a SNOMED section on the right side of the dialog. Just like with diagnosis, you may encounter several situations here. The procedure may not have any SNOMEDs attached by default, it could have one, or it could have many. The first time you select this procedure, you will always have to search for and attach the appropriate SNOMED. However, if you select Save after attaching a SNOMED, then that preference will be saved for this user for any patient going forward. To attach a SNOMED, click Search. Then type what you're looking for, and when you find the correct option, highlight and click OK. If you need to attach another SNOMED code, then click Search again. And type what you're looking for, highlight the option, and click OK. If you changed your mind and you do not want to attach both of these SNOMEDs, you can always uncheck the Apply checkbox for the SNOMED that you do not want. Or, if you do not want that SNOMED showing at all, then highlight the line and click Delete. Beyond attaching SNOMEDs to your procedure codes, you can also attach SNOMEDs to your modifiers. After selecting the modifier, highlight it and click Search. Find the right option and click OK. If you make changes and decide that you rather this be your default settings going forward, then click Save. If you do not want your changes to be your default, then simply close this dialog without clicking Save. And as you can see, no SNOMED information will print in your note. Now there is one last addition related to SNOMED, and that is a new configuration. If you go to Edit, Preferences, on the General tab, you will see a new checkbox option for Display a warning when a SNOMED code is not selected. By default, this will be turned off. However, if you prefer to be warned if you are missing a SNOMED code on a procedure, diagnosis, or any field that could have a SNOMED attached, then you would want to turn this on. This is a per-user setting. So to recap, you will now have the ability to attach SNOMED codes to procedures and modifiers. This only becomes a requirement in Stage 2 of meaningful use for certain clinical quality measures that are related to procedures, so it should not be a great impact on your day-to-day documenting of patient information. The last enhancement we will discuss today is the addition of the medication history consent. This can be done in either Practice Manager or Clinical. However, I will show it to you in Clinical. To access the consent dialog, open the patient's chart, and then go to the ID tab. At the top, click the Consent button. The top section of this dialog is the new addition for 4.7. This section allows you to designate whether consent was given to electronically access the patient's medication history via the SureScripts network. Per SureScripts' new requirement, medication history will now only be received for those patients that have given an affirmative consent and are marked as such in this dialog. The two yes options that you see here will differ based on the patient's age. For patients 18 and older, the options will be yes, consent given, and yes, guardian/POA consent given, like we are seeing here. For patients younger than 18, the options will be yes, parental/guardian consent given, or yes, emancipated minor consent given. Once you've selected an option other than Not Asked, you will then receive the ability to configure the date to which the consent was given. It will automatically default to today's date. If you had selected one of the Yes options, you will also have the ability to select the provider that was given this consent. And as you can see, you will have the option to select all providers if necessary. Beyond having the ability to document this here on the ID tab, you will also have the ability to do this on the Prescribe dialog as well. So let's go into a chart and take a look. First, select your medication, and then on the Prescribe dialog, you will see that there is now a Medication History Consent button at the top. You will also see the current status of this consent on the button, so you will not need to go into the dialog to find out that information. If you click on the button, you will receive the same dialog that we had seen through the ID tab, and you can modify and save your information through here as well. After affirming your consent to view medication history, You will be allowed to view the information available through this button, which includes all the medications that the patient has been on in the past 2 years, whether prescribed by one of your providers or someone else. Okay, so to recap, you will now need to confirm the patient's consent in order to view their medication history. This can be done in Practice Manager or Clinical. If you are in Practice Manager, this dialog is located on the Patient tab. In Clinical, you can either access it on the ID tab or here through the Prescribe dialog. That concludes our course on the new enhancements and features in 4.7. If you have any questions about anything covered in this course, you may refer to our website, sdicomputer.com, or call customer support at 1-800-487-9135.